Hidden clock that controls your heart, hormones, and life. You may think your heart attack happened suddenly, but what if I told you it was scheduled, not by fate, but by your body clock? Every cell in your body follows time. Your heart attack, your heart, brainstorm, hormones, blood pressure, cholesterol, peripheral disease, liver damage, pancreatic failure, everything is pre planned. You know what's the reason behind it? The invincible timing system is called circadian rhythm. Ignore it and disease follows. Respect it and the body heals itself. Today, in this video, I am going to explain what is circadian rhythm, how it importance in creating disease and healing the disease, and what are the steps to maintain, to comply with the circadian rhythm, how to get rid of disease, how to get rid of unnecessary complications, procedures, hospital admissions. So let us dive into the topic. What is circadian rhythm? Circadian rhythm is internal 24 hours biological clock. The word circadian, it comes from Latin. Circa, C-I-R-C-A means around. D-M, D-I-E-M means day. So it means around one day. These clocks exist in your brain, in your heart, in your liver, in your pancreas, even inside every single cells of your body. But the master clock is located in the brain, in a tiny area called suprachiasmatic nucleus or SCN. This master clock uses light as its main signal. That light tells your body when to eat, when to wake up, when to sleep, when to release hormones, when to raise your blood pressure, when to raise heart under maximum stress. So, the SCN biological clock center controls our body round the clock. In the morning hours, when you wake up, when the sunlight enters in your eyes in the morning, it suppresses melatonin, sleep hormones, and it activates cortisol, that's a wake up hormone. It raises heart rate, raises blood pressure, activates metabolism. At the same time, reversely, at night, doctors should increase melatonin, reduce cortisol level, reduce heart rate, allows repair, healing, and detoxification of your body, internal organs. But what we are doing in our modern life, the modern life has broken our system. Artificial light, mobile phones, late night screens, shift work, night eating, all confuses your brain. Your body no longer knows, is it a day or night? Should I repair or fight the system? Should I sleep or should I wake all the time? This confusion is called circadian misalignment. And this is where disease begins. The main reason for the disease, particularly diabetes, hypertension, atherosclerosis, fatty liver disease, the circadian rhythm misalignment is the main reason for that. Let us see how the circadian rhythm works in the heart. Let us talk about cardiology part. Most people, they don't know these heart attacks, strokes, sudden cardiac death occurs most commonly between 5 a.m. to 11 a.m. You know the reason? Why? Because in the early morning, cortisol level surges, adrenaline level surges, blood pressure spikes up, platelets becomes more sticky, blood becomes thicker, coronary arteries constrict. This is not random. This is circadian programming. No need to worry about this abnormal phenomenon. If a person has already vulnerable plaque, endothelial dysfunction, high stress, poor sleep, morning becomes a danger zone. That is why BP is highest in the morning. Arrhythmias peak early morning. Sudden death occurs during sleep or early wake up hours. The circadian rhythm controls your heart risk timing also. That is the reason most of the heart attacks happens between the early morning hours due to spike in stress hormones. Let us see circadian rhythm and diabetes obesity, how the circadian rhythm plays role. Your body is not designed to eat all the day. Insulin sensitivity, highest in the morning, moderate in the afternoon, lowest at night. But what is happening exactly? Late night eating causes higher insulin levels, more fat storage, increased triglyceride level. It can cause fatty liver, insulin resistance. That's the reason night shift workers, they are prone to have higher diabetics risk, higher obesity, higher heart attack risk, and higher cancer risk. Why? Because the pancreas has a clock, the liver has a clock, fat cells have clocks. Eating at the wrong time is like putting petrol in a parked vehicle with the engine off. So ultimately the fuel becomes burden to the engine. So the fuel becomes fat, not energy. Let us see how the circadian rhythm controls our sleep and the mental health, stress also. Sleep is not a reset. Most of the people think they talk sleep just I'm going to take rest like that. Sleeping is not a rest. Understand? Sleep is a repairing mechanism. It repairs all the damages. During proper night sleep, growth hormone is released. Cells repair DNA damage. Brains clears toxins. Inflammation reduces. Blood vessels heals itself. Let us see. Opposite, poor sleep and lack of sleep, inadequate sleep, it can cause depression, anxiety, memory loss, hypertension, heart failure, sudden death. Melatonin is not just a sleep hormone. Most of the people they think it's only specific for sleep hormones. No. You know the wonderful fact. The melatonin is a powerful antioxidant. Nobody has told you before. It has an anti-inflammatory property. The melatonin has an anti-cancer property. It has a cardioprotective property. When the melatonin is suppressed by your modern day lifestyle, like mobile screens, LED lights, late night stress, alcohol, irregular sleep, then you think of it. Naturally, the melatonin level will come down. You may develop blood clot, higher hypertension, heart failure, stroke, and increased level of diabetes. Let us go into the circadian rhythm, how it affects our modern diseases. What we call it like modern diseases: hypertension, diabetes, obesity, heart attack, stroke, depression, cancer, autoimmune diseases. The modern medicine treats only the symptoms. It's not treating the root cause. When whatever the treatment, whatever the machineries, whatever the invention comes, it can superficially treat only the symptoms, not the root cause. But chronobiology treats time. Future medicine will not ask what drug you are using. It will ask what time. That is the reason doctors always prescribe BP medicine, statins, antiplatelets, lipid lowering drugs, diabetic medicine, insulin. They give in a specific time. So the time is very important. The time itself can heal your body, not the medicine. It can heal the root cause. So how to reset your circadian rhythm? Let us see practically. Morning sunlight is very important. 15 to 30 minutes. No sunglasses initially. This resets the master clock. Fixed sleep and wake time. Same time every day, even on weekends. Stop eating 3 hours before sleep. Night eating destroys insulin rhythm. Reduces blue light at night. No mobile phone, no gadgets, electronic gadgets before 1 hour going to sleep. Use warm lights, dark bedrooms. Exercise time is very important. Morning or evening, go for regular walking, 30 minutes to 45 minutes, not in the late night. Improves sleep hormones. That improves sleep hormones. Meditation lowers cortisol, adrenaline, and sympathetic overdrive. So meditation will help. Meditation restores parasympathetic drive. It heals the state. Meditation literally resets your clock. Your body is not broken. Most of people think you are diseased. You are not diseased. You are in untime in respect to biological clock. It is out of time. Heart attacks are not sudden. Diabetes is not accidental. Obesity is not weakness. They are rhythm disorders. If you align with the time, your body heals. If you fight with the time, the medicine will only delay the disease. This is the future of preventive cardiology. If this video changed how you think about health, like, probably share, subscribe, and remember, respect time, and the time will protect your heart. The time is everything. So in this video, think you have understood the importance of timing, the circadian rhythm, 24 hours biological clock, how it controls our body. What's the reason behind our chronic diseases? So if you follow the time strictly, you can get rid of disease. You can lead healthy life. You can lead healthy life without medications. You can lead healthy life without major surgeries. You can avoid sudden cardiac death or high risk diseases, heart failure, cancer, stroke. So the time is everything. I will see you in the next video. Until then, bye bye. Take care of your heart. Thank you.